So the disease actually is a neurotransmitter deficiency. This molecule, we call this dopamine. Actually, if I mention Parkinson's disease, people will be easier to understand. So in Parkinson's disease, because of degeneration of brain cells, so they have dopamine deficiency. So we know that they have movement disorder. They move that got a rigidity, for example. So in AADC deficiency, this is an enzyme that responsible for the production of dopamine. So this is a congenital deficiency of dopamine. So the child, the baby, they don't have dopamine in their brain in the first day when they were born. But initially, for the first few months, the babies looks normal. Then when normal baby get head control, they can sit up, they can stand up. For a classic type of patient with AADC deficiency, they don't have any of those development. So this is a very severe disease, but certainly for any disease, there will be milder variant. But I think today we will focus on those young children. They are severely affected. So they represent the larger portion of the disease. Yeah. But unfortunately, the current medication for the disease, they are not very effective because the thing the patient don't have is dopamine. And for Parkinson's disease, the very effective drug is levodopa. So it's dopa, the precursor of dopamine. For levodopa, it's easy to get an oral pill, then the drug will enter the brain and help the brain. But dopamine, because of its charge in the molecule, so it cannot get into the brain. So we need to use other dopamine analog. We call the dopamine agonist or dopamine receptor agonist to stimulate the brain, but they are not as effective as dopa responsive disease. So for this disease, the medical treatment until now, they are not very effective, and the disease is very severe. So without any effective treatment, the patient can die within the first few years of life. So even though it's a very rare disorder, but this is a bad disease, so it's a common way to say that. Yeah. So since a few years ago, we noticed that this is a disease, there's no treatment, and the patient, they do need a treatment. Yeah. So then we go back to Parkinson's disease because it's a big, very important disease. So there are all a variety of approaches to the treatment. So one approach is actually use this AADC enzyme as a target because in Parkinson's disease, as I said, they can use levodopa. But when the cell degeneration, the neuron degeneration progress, this enzyme AADC becomes deficient in patients with Parkinson's disease. So quite a few years ago, there are a group of people, they tried to do gene therapy with AADC enzyme for Parkinson's disease. But unfortunately, that was not very effective because this is Parkinson's disease is a degenerative disease. So after all cell death, then nothing will be effective. But that treatment, if they can be true, then will be a cure in my patient with a congenital deficiency. So around 10 years ago, we start to develop this treatment. And the staining process is quite easy. At that time, the only available serotype is AAV2, but in turn, AAV2 is until now, is still the best vector for transduction of neurons. So this virus only get into neuron, they will not go to glial cell, for example. So we put the cDNA of AADC into this virus, use just a general promoter, and we use injection method to inject the vector directly into putamen. So putamen is the place that dopamine work. The cell produce dopamine, actually, they are in brainstem, but they send a very long axon to putamen and release dopamine in the putamen. So it's much easier to inject putamen rather than go deeper into the brainstem. So at that time, we decide that we just inject the putamen with this AAV2 AADC vector. We can say, as we expected, the treatment is very effective. So because of dopamine deficiency, those children in most of the time, they are very floppy, so they don't move. So in medical term, we call this hypokinesia, so they don't move. So we do the surgery, and the surgery is just like a deep brain stimulation. I wonder, I think many people know that. It's very similar to deep brain stimulation, and we just inject the virus, a very little amount, into bilateral putamen. If everything was done correct, and we have done 30 times, all successful, we never fail one. So around 4 weeks after the virus injection, the patient start to move. They move a little bit, like finger, or they can move their trunk a little bit. But initially, the movement, they are not coordinated because they just move, they cannot control. So this irregular movement that will peak around 2 months after gene therapy, and then it get down a little bit, little by little, because of the receptor try to adapt for the new coming dopamine, and try to also get more control of their extremities, and then their motor development start. So for a successful treatment, usually 1 year after treatment, patient can have good head control. Half of them can sit with or without support. And we got like 10-15% of patients, they can stand up and walk a few steps. So I think the outcome is quite dramatic. And so we essentially, this treatment alter the natural history of the disease.